Hello, everyone. My name is Stefanos Alevizos, and I'm psychologist in a Greek NGO called The Smile of the Child. In this webinar, we will discuss about the coronavirus lockdown and its impact on domestic violence. And I will try to present you the system of services that The Smile of the Child runs in order to protect every child in Greece. First of all, let me introduce you to our organization. The Smile of the Child was founded by a 10-year-old boy called Andreas Giannopoulos. Andreas had serious health issues, health problems. So before he passed away, he dreamed about an organization that will protect every child in Greece. After he passed away, his father, Konstantinos Giannopoulos, made his dream a reality. Today, the Smile of the Child runs services for abused children, for children go missing, for children with health issues, and children and families facing problems of poverty in 3 dimensions: services and of prevention, of intervention, and also therapeutic services. We are a very well-known organization here in Greece, probably one of the biggest one. We work closely with the public sector and also within international networks, European Union, and the United Nations. So, as I have already told you, we will discuss about the domestic violence phenomenon and its connection with the coronavirus lockdown, and how the Smile of the Child has implement many services, many actions in order to protect children here in Greece. Okay, let's talk about some main dangers during this pandemic lockdown, some dangers that link to domestic violence, the rise of domestic violence incidents. For example, we have some negative feelings such as anger, anxiety, and stress. Many people face these feelings. Many people, in order to deal with these feelings, are drinking alcohol. They are abused. We observe alcohol abuse. We have a low income. We have some gender stereotypes strengthened. For example, we hear a lot in our national hotline that many people saying that, during this lockdown, girls should learn to cook and serve boys or whatever. Some child protection services are closed, and we have the lockdown of schools, so many children don't have their source of help through their teachers. Okay. Some data now all over the world. As you can see, in Australia, France, United States of America, United Kingdom, and Spain, we already have an increase on calls and asks for help from victims of abuse, of domestic abuse from women or also for children. In Italy, we had a decrease. Unfortunately, in Greece, we don't have a national center collecting data about abuse, so we are not sure about the situation here. In the national helpline of the Smile of the Child, we have an increase for people asking advices of how to deal with issues related to the lockdown. Now, we have to note 2 main points that we know from literature. First of all, that children with disabilities are in great danger during this lockdown. And we know from surveys, from literature, from previous lockdowns, that we will have an increase on domestic violence. Probably we will be in a position to speak with data after the ending of this lockdown. But we know that we will have an increase of domestic violence. We know that now we are talking people, children, women are in danger. And I will show you what the Smile of the Child has done in order to protect them, protect more and more children here in Greece, children and families. Before that, I will also have to note down that we have an increase also on online sexual abuse. We have the data from Europol. We have an increase on the visit of child pornography sites, and we know that the new chat rooms have created for online abusers that they are discussing about children and trading child pornography material. So, as I told you, I will try to present you the model that the Smile of the Child runs in order to protect children in danger, especially during this period of quarantine, of this period that people stay at home. I have to say that we think that the most effective way in order to prevent, to protect, to secure children and families is based on the holistic approach. So we have actions of intervention, prevention, intervention, and therapy. I will start with this is the model I told you about, the holistic model that we run, and we believe that this is the way that we will be able to reach more children and protect more children from their abusers. I will start from the action of prevention. Nowadays, more than the previous, before the lockdowns, we are trying to have a great mass media coverage about issues related to domestic violence, to quarantine, in order more and more people to learn to be able to recognize the signs of abuse, and also to learn the services that they can refer to in order to ask help. In order to be more effective, we run a program in schools through platforms. We have Smile Academy, a web platform that we perform prevention programs in schools, both primary and secondary level, in order to train children how to recognize signs of abuse, how to protect themselves, and where and how they can ask for help. It is very important for children to understand, to be able to distinguish between the paternal or maternal love and the abuse. Moreover, we run the European Helpline for Children and Adolescents, 116-111, where psychologists advise children and parents on how to deal with many issues that are related, with the domestic violence phenomenon. As far as the intervention is concerned, we run the national helpline, as I told you, for children, SOS 1056, where social workers and psychologists work in a 24/7 basis, and they take anonymous and named reports for children at risk. They can immediate intervene for children at risk. They activate all care procedures for abused children who are in hospital, this transitional stage here in Greece. They are handling requests for accommodation of abused children and provide guidance for every issue. And we connect families, women, children with other services if it is necessary. I have to mention that the helpline is interconnected with the European emergency number 112 in order to be accessible in more and more children. As I told you, we have a program of direct intervention. Apart from the police procedure, we are trying to be next to every child victim of abuse. Our social workers, our psychologists, are next to every child in all the legal procedure, from the removal of their home, from their testimony in the police station, and their medical examination. A social worker and psychologist accompany children in all the procedure. Last but not least, we have the House of the Child, a unique day center here in Greece, a therapeutic center for children victims of any kind of abuse. In this time of period and quarantine, psychologists, psychiatrists, therapists, social workers, all the healthcare personnel provide their services through the platform of Smile Academy. We use this platform in order to not interrupt their therapeutic procedure. In order to be more efficient, we have many collaborations. For example, in order to protect women with children that are at risk nowadays, we have a strong collaboration with the European Anti-Violence Network and the General Secretariat for Gender Equality of the Ministry here in Greece. And the three organization, we work closely in order to provide support, help, shelter in every woman with a child that is in danger here in Greece. Okay, this is our sources. And finally, as a conclusion, I would like to point out that in this period, during this period of quarantine lockdown, only under the spectrum of collaborations, of holistic approach and technology, we will be able to protect more and more children. We remain at your disposal for any further information of how we use Smile Academy technology in terms of prevention and in terms of therapeutic services. Thank you for watching this webinar.